Public hospitals across Nigeria have been disrupted following a nationwide strike by the joint health sector unions JOHESU over unresolved salary issues. Approved in 2024, the Consolidated Health Salary Structure (CONHESS) remains unimplemented according to the union. At midnight on November 14, 2024, years of negotiation gave way to action as JOHESU commenced a nationwide strike.
The crisis we have in the nation's industrial relations sphere is not that of reaching agreement. It is that of faithfulness to agreements that have been reached. The JOHESU issue speaks to that. The National Association of Resident Doctors speaks to that. And the other tertiary education unions speaks to the same crisis. You cannot sit down with people, discuss with them, negotiate with them, agree with them, sign agreements, and you refuse to implement. So faithfulness, that is infidelity. That is irresponsibility. That is living in falsehood. It tells you the way the people that occupy the corridors of power in Nigeria, take Nigeria. They take Nigeria, they treat Nigerians with disdain and contempt. And let us discuss with them now. There not be discussion. It's what they will say. Not be discussion. We talk with them now. Not with the talk. So there is no seriousness, there is no regard, there is no respect, there is no honor. So they discuss with you, they sign an agreement, they refuse to implement. Tell me, what is the next option for the worker? What is the next option for the union, if not to withdraw their services?
The industrial action has withdrawn an estimated 85% of public health workforce from duty, significantly affecting service delivery in government-owned health facilities across the country. The two conciliation meetings involving the Ministry of Labour failed to resolve the dispute, leaving hospitals operation at minimal capacity.
I know for one that one of the major reasons why we have many healthcare workers, not just medical doctors, I mean all healthcare workers travel abroad, is because of the poor remuneration in Nigeria. And it's been fought for a very long time with no one, no one listening, or I would say that nothing significant has been done, maybe because the line budget is not improved and because of the minimal inflow from different areas whereby Nigeria really focuses only on oil and gas. Peradventure, if Nigeria begins to look into getting income from other sources, I know that for sure many other things will be improved. But with one or two major sources of income, many other things are affected negatively. Part of it is the healthcare and the healthcare workers' remuneration.
It's not because it's a pre-election year. Strike is costly. It takes tolls on the leadership of the unions, and it demands a lot of resources to organize strikes. We do not like strikes. Let me repeat, we do not like strikes. And so most of the time, you find that we do everything possible to avoid strike. And so I will tell you for free that there is a strategy, because this is the best time to hold it. But it has become compelling that those workers must do, and that is the only way they can force the government to comply. But unfortunately, because of the wickedness of those who occupy the corridors of power, you can go on strike if you are in the health sector. If they have malaria, they go abroad. They don't care. It doesn't concern them.
Hospital authorities warn that prolonged industrial action could have serious implications for patients and the health system. JOHESU insists the strike will continue until the adjusted CONHESS is fully implemented. Sydney Okafor for the HR Anchor.